It's my pleasure to welcome Devon Poznanski, thank you, to moderate the panel. Devon is a lead in the Patient and Family Experience Program at BC Cancer. Her role focuses on patient education and patient engagement. Devon works with staff to create patient education resources written in plain language. In her work, Devon encourages staff to work with patients, families, and caregivers to ensure they are creating resources their audience needs and that they understand. She incorporates health literacy and best practices in all of her work. She strongly believes that all people with cancer deserve access to simple, clear, easy to understand information, as this is really critical to helping people manage their health and achieve positive health outcomes. Okay, I'm going to hand it over to Devon, and it is all on and ready for you.
Thank you so much. Hi, everyone. I'm happy to be your moderator of today's patient panel. So thank you for that introduction. And I am going to let each of the panel members introduce themselves, starting from the left.
Hi, I'm Sarah Lett, and my pronouns are she, her, and I'm grateful to be visiting today from the Lekwungen unceded territories, where I'm grateful to live by the ocean. Since 2019, I've been fortunate enough to be a patient partner of the endometriosis and pelvic pain research, along with Jessica here and our leader, Heather Noga, in the audience. We're happy to be here today.
I just forgot to also introduce Pilar, our Spanish interpreter, who will be helping us communicate with Christian. So, thank you, Pilar.
And hi, my name is Jessica Sutherland, and I, as Sarah said, am also on the endometriosis Patient Research Advisory Board for the Endometriosis and Pelvic Pain Lab at UBC. And when we refer to the advisory board, we might call it the PRAB because it is much easier to say. I've been collaborating on research and helping to develop digital tools and resources since 2017. And I'm also a technical communicator.
Buenos días.
Good evening, or good afternoon, sorry.
Mi nombre es Cristian Díaz, vengo desde Colombia.
My name is Cristian Diaz and I come from Colombia.
Soy ingeniero de sistemas, desarrollador de software.
I am system engineer and I develop software.
Agradezco la invitación a este evento, ya que tengo la posibilidad de estar, digamos que en los dos lados de la mesa.
I thank you for being participating in this event because I am able to be in the two sides of the table.
Así que hoy vengo del lado del paciente porque he tenido diferentes experiencias en diferentes países.
I come here as a patient because I have had many experiences as patient in many countries.
Tanto presencial como virtualmente. Así que todo este conocimiento y experiencia lo hemos ayudado en un proyecto con PHSA.
And I have been in person and virtually as patient, and I'm participating in a project with PHSA.
Y agradezco la invitación. Muchas gracias.
And I really thank you for the invitation. Thank you.
Thank you, everyone. Okay, so let's get started. When we were preparing for this panel, we were trying to decide what the focus of the discussion would be. And something that kept coming up was, how do we build trust in digital health tools so that patients want to use them and that they are working for them and the tools eventually help improve their healthcare and their health experience. So I will kick off the questions. So our first question is, what is one recommendation that you would have for digital health tool developers that would help build trust in patients or the end user? So just for fun, why don't we start in the middle?
There we are. So I think something that's incredibly important, and actually before I answer the question, I would like to take a moment to thank all of you for joining us here. In particular, I really enjoyed the student posters If you haven't had a chance to look at them or to watch the presentations online, I wholeheartedly encourage you to do so. The vast majority of them have included patient partners and patient input. And I'd like to first give the students a round of applause. And then to answer the question, I think something that is so vital and so important is to know your audience. So you might be writing for people who don't necessarily understand jargon-filled medical terminology. You need to meet people on their level where they are, and you need to have patients and people with lived experiences and users involved from the beginning of tool development, because you do not know if your tool will even be useful at all if you're not asking the people who will later use it. I'd say patient partner participation and user participation and using accessible language would be my number one thing that I would suggest.
Christian, would you like to offer your recommendation?
Ok, esto, cada vez que escucho esta pregunta,
Each time that I hear this question,
recuerdo una experiencia de mi madre.
I remember experience with my mother.
Mi madre tiene aproximadamente 76 años.
She's around 76 years old.
Ella padece de diabetes
She
y
suffers diabetes,
presión arterial alta.
high blood pressure,
Y como las personas de su edad, siempre ha estado nerviosa acerca de la tecnología.
and people like her with old age, she's very nervous with technology.
En una cita de control que
In-
tuvo de su diabetes,
In a follow-up appointment regarding her diabetes,
iba a hacer una cita por medio de una app en su celular.
she was going to do an appointment via an app in her cellular phone.
Casi siempre ante esta situación se pone muy nerviosa.
She's always very nervous in a situation like this one.
Y cuando llegó el momento de la cita,
And at the moment of the appointment,
se hizo la llamada, entabló conversación con el doctor
the phone call was made and she started the conversation with the doctor
y todo transcurría normalmente.
and everything was fine.
Mi madre estaba muy preocupada acerca de unas manchas que estaban saliendo en su cara,
My mother was very concerned about some spots that were appearing in her face, on her face.
de modo que intentó decirle a la doctora lo que estaba ocurriendo.
And she tried to express this to the doctor.
Así que tratando con la videollamada en su celular, trató de subir su celular para mostrarle.
So she tried to use her cell phone and show her cell phone to show her,
Pero como hacen todas las madres, sobre todo de mi edad, de la edad de mi madre,
as all the mothers of my mother's age, they do.
de una manera inexplicable cambió la cámara.
She changed the camera without any explanation.
Así que no estaba mostrando la cámara de ella de frente, sino la cámara posterior.
She was not showing her face, but the other side of the camera.
Por supuesto, el doctor le preguntó, no te veo, no, señora Angélica, no la veo.
And the doctor said, I don't see you, Angelica, I don't see you.
Por favor, cambie la cámara.
Please change the camera.
Mi madre poca habilidades tiene con los celulares.
My mother doesn't have much ability with the cell phones.
Trataba de buscar el botón de cambiar la cámara y no lo encontraba.
She tried to find the button to switch the camera, but she couldn't find it.
El doctor de manera muy diligente dijo que iba a volver a llamar.
The doctor said that he was going to call again, very responsible.
Volvió a llamar, de nuevo la conversación empezó,
She called her back, the conversation started again,
pero mi madre de nuevo hace la misma acción y coloca la cámara posterior.
but my mother did the same mistake. She switched the camera.
Ante esa situación, mi madre se desespera
So she got desperate
e intenta hacer algo creativo,
and she tried to be creative.
y es voltear el celular para que la vean.
So she switched the cellular so that she is seen.
Pero hacer esto hacía que perdiera la comunicación y el contacto con el doctor.
But then in this moment, she lost contact and communication with the doctor.
Y peor aún cuando intentaba mostrarle dónde estaba su mancha,
And it was worse trying to show where the spots were
porque a veces olvidan dónde está la cámara.
because she forgot where the camera is.
Así que lo ponía más alto o la ponía más bajo.
She put it up or down.
La situación es, yo llegué en ese instante y la situación es algo graciosa,
It was a funny situation when I arrived,
pero realmente es desesperante para el paciente.
but for the patient, it was very frustrating.
Todo esto para mencionar que es importante que los pacientes siempre estén durante todo el proceso de desarrollo de herramientas.
For this reason, I mentioned this because I think the patient had to be involved in the process of developing these tools.
Los expertos que saben de innovación hablan acerca de un customer journey,
The experts in innovation, they're talking about customer journey.
así que sería interesante que hubiese algo como un patient journey,
It would be interesting to have a patient journey,
ya que si en esa situación hubiera una persona analizando esos puntos de encuentro,
so if in that situation a person is analyzing these points of encounter,
donde los pacientes se sienten frustrados, se sienten tristes, se sienten mal,
where the patients feel frustrated, sad, bad,
podían mejorar ciertas herramientas para un mejor uso de las mismas.
they could improve certain tools for the better use of them.
Tal vez este ejemplo sencillo aparentemente podría ser controlar el bloqueo de la cámara posterior,
Maybe this simple example, which is just related to the camera, switching the camera,
hace que la experiencia del usuario no sea grata.
makes the user experience or the patient experience not very comfortable.
Así que el involucrar a los pacientes en todo ese proceso es algo muy importante.
So to involve patients in all this process is very important.
Pero aún más es importante segmentar esos pacientes,
And even more, it's more important to segment the
Por-
patients,
porque no es lo mismo una herramienta como esta para mi madre que para mi hija que tiene 20 años.
it's not the same a tool for my mother than for my daughter who is 20 years old.
Thank you.
Thank you.
Thank you, Christian. Sarah, did you want to?
Thank you. So some way that developers could bring trust into the equation when they're building healthcare platforms is for you yourselves to QA, quality assurance, these digital health tools when you're at your working worst. So whether that's before your first cup of coffee of the day, lunchtime snoozies, 4:30, you really want to get out the door, take a second and go through your digital platform when you are at your worst. Patient partners included would be great. And before that gets to them, that will put you in their possible mindset because many of your end users will be using your digital health tools possibly on their worst day.
Thank you. Those are great points. And as Tina mentioned, I work in patient education and all of these recommendations apply to what we do at BC Cancer is we try to involve our patients at the beginning of developing a handout or a video or web content because you think you know everything that you want to tell them, and you do from your perspective, but there are things that patients or families have questions about that you may not think of if you've never been in that situation. And I'm going to give a really quick example. That's not my example, but I use it a lot, is that someone told me once that they were developing a handout for people who had hysterectomies, and they were telling them all the post-surgical care and all the implications of having that and everything that was very important for them to take care of themselves and what was medically necessary. And when they brought it to patient partners, once they developed the tool, having not involved them earlier, a lot of the people were like, okay, this is great, but like what happens to the big hole that's left when you take everything out? And it was not like just one person, it was a few people. And it seems like a silly thing, but that's a legitimate concern that someone may have when you take a large organ out of their body. And it was just a simple fix. And if they had engaged the partners a little earlier in the process, they would have had that feedback and wouldn't have had to, edit the handout. So I highly encourage anyone who's developing anything for patients to involve them early. Okay, so I have other questions, but I would like to open it up to the audience because our patient partners have a wealth of experience. And so, yes, we have a question right here. Do we have a microphone runner? Yep, there's someone coming up right behind you. Right there in the blue shirt.
Thank you. To sort of follow on with the question or the story that you just told, to follow with the story that you just told about something that you didn't expect, I had a question more language-based for Christian. There are lots of possible problems that a provider who speaks one language could foresee in dealing with someone who is not a primary language speaker. Can you tell us about a time when there was something you did not expect from your side? You can think of some problems you may have speaking with a provider, but can you tell me about a time that you were surprised by something that may have been caused by a difference in language?
One of my experiences, my own experiences.
Yes.
Sí, sí.
Ok, sí tengo una experiencia.
Yes, I have an experience.
Estuve en el hospital de Pisarch
I was in the Pisarch
en
Hospital
emergencias.
emergency room.
En primera instancia, pregunté si tenía una posibilidad de ayuda lingüística, un intérprete,
First, I asked if someone could help me, like an interpreter,
pero me dijeron que no.
and they told me that no.
Entonces, estamos recién llegados a Canadá,
So we were just recently arriving in Canada.
así que todo es nuevo.
Everything is new for us.
El mismo procedimiento no lo teníamos claro, así que nos dejamos llevar por nuestro sentido común.
We didn't have clear what was the procedure, so we just follow our common sense.
Y el sentido común nos decía que deberíamos hacer un check-in,
Common sense told us, do a check-in,
tratar de explicar lo que nos estaba ocurriendo, lo que me estaba ocurriendo, los síntomas,
try to explain what was happening to me, my symptoms.
pero en ese momento uno siente cierto nerviosismo,
But at that time, one feels very nervous
porque cuando uno está frente o está hablando acerca de o de dinero o de salud,
because when one is talking about money or health,
uno quiere estar seguro de lo que está diciendo.
one wants what to be sure of what he's saying or she's saying.
De modo que traté de empezar a hablar. Afortunadamente no entiendo algo de inglés
Therefore, I try to express myself. I understand some English,
y la persona que me atendió también hizo lo posible para que yo le entendiera.
and the person who was in front of me tried to do as much as possible to understand me.
Sin embargo, mi esposa, que no habla nada de inglés, estaba muy nerviosa.
But my wife doesn't speak any English. She was very nervous.
Nos hicieron ingresar a emergencias
We got into emergency.
y estando allí no sabíamos que dentro de la sala de espera
Being there, we didn't know that in the waiting room
nuestro acompañante podría entrar con nosotros,
that our companion could come with us.
porque en nuestro país no sucede así.
In our country, that doesn't happen.
Entramos solos,
We go in alone.
de modo que mi esposa se quedó afuera.
So therefore, my wife stayed outside.
Creo que estuvimos tal vez 6 horas
I think we were there around 6 hours
esperando que nos atendieran.
waiting to be assisted.
Cuando me enteré de que podía entrar, entonces le dije, ven, puedes entrar.
When I learned that she could come in, and I asked her, yes, you can come in.
Porque evidentemente estaba nerviosa y no sabía qué estaba pasando.
Because she was nervous, she didn't know what was going on.
Para hacer un poco corta la historia,
To make the story short,
solo hubo un momento en el cual tuvimos un soporte de intérprete.
only at some point we have just an instance of support by an interpreter.
Y fue cuando llegó un neurocirujano
Is when a neurosurgeon appeared,
y después de diferentes exámenes que me hicieron,
and after some tests that they did,
esto fue aproximadamente a las 10 horas de haber llegado,
it was 10 hours after being there.
me trata de explicar qué está ocurriendo,
He tried to explain me what was happening,
pero como la ley es de Murphy,
but because of the Murphy law,
su acento era británico.
his accent was British,
So fue más difícil entender qué
so
estaba
it
diciendo.
was harder to understand what he was saying.
De modo que preguntamos por un servicio
So
de
we asked
traducción
for a service, for a translation or interpreting service.
y trajeron una máquina, un aparato, un dispositivo
They brought a device
que hacía una llamada telefónica a un centro de traducción
that makes a phone call to a translation center.
y hicieron esa llamada, pudimos comunicarnos, sin embargo, desde mi punto de vista,
We did a phone call and we could communicate. However, from my point of view,
creo que la persona, el intérprete, trataba de buscar ciertas palabras para decirme a mí,
I think the interpreter was trying to find certain words to communicate with me.
dándome la sospecha que tal vez no era una intérprete especializada en temas de salud.
Then I suspect that this interpreter was not specialized in health.
Esa es la experiencia que tengo. Tuvo un final feliz,
That was the experience I had. It was a happy end,
pero sí hay unas barreras lingüísticas importantes que resolver.
but there are linguistic barriers that are important to resolve.
Thank you.
Thank you.
Thank you, Christian. We actually have a question online, so I will read it out. My question relates to home care settings and patient portals. Do you have any suggestions for how to engage patient partners when developing patient portal views, specifically related to medication for nurse-administered and client-administered medications? Who wants to take this one? Don't all fight for it at one time.
Okay. So I don't know where the camera is. I think it's there. So with medications and home portals, I guess a great way would be to have an easy access, if it's not already included, for that giant list potentially of medications that the patient has been on, is currently on, ones that they didn't like. They may work in the medical sense, but perhaps not for the patient, and anything else. So yeah, just again, from the patient's point of view, like, yes, there's a medical success, but maybe not from a patient's success standpoint to differentiate those. So that's very clear.
And if you're talking about including patients when you're developing something like a medical portal, there are so many patient advocacy groups already, and so many groups of patients who would like to participate and make their care better. I'm not going to generalize about all patients, but for me, I'm incredibly motivated. I could say, Christian, would you say you're also motivated? Yeah. And Sarah, and we've encountered so many people who would like to participate, to be a part of making our care better, because we all know that there are some ways in which the healthcare system is really succeeding in the care element, but so often it becomes about health service and not about health care.
Christian, would you like to add anything to that?
Sí, que quisiera agregar
I wanted to add,
que desde la perspectiva de paciente,
from the point of view of the patient,
lo que regularmente uno quiere tener es una buena experiencia
what we want to have is a good experience,
y en lo posible tener todo junto.
and if possible, to have everything together.
Yo sé que, como les dije, estoy del otro lado también de la mesa
As I said, I'm on the other side of the table
y
as well.
sé que en algunos momentos eso es muy complicado porque hay muchos actores en todo esto.
And I know that this is very complicated because there are many actors and participants in all this.
Pero desde el punto de vista de paciente, uno quisiera tener todo en un solo sitio.
But from the point of view of the patient, we would like to have everything in a single place.
A veces es complicado tener que hacer un appointment en un website,
It's complicated to do an appointment in one website,
tener una cita médica usando Zoom,
doing an appointment with Zoom, via Zoom,
recoger o revisar los exámenes en un correo electrónico
to check your test results in a email,
y tal vez llamar por teléfono cuando hay un soporte y la llamada se cae.
and then to make a phone call and the phone call doesn't work.
Entonces, la oportunidad de mejorar y tratar de tener todo consolidado es una buena opción.
So there is an opportunity to have everything consolidated. That will be a great option.
Great, thank you. There's a question in the audience. I just wanted to quickly comment on this question as well. We did a little bit of work at BC Cancer with Patient Portal prior to where it is right now with PHSA, but we did do a survey related to our patient portal. And in terms of how to engage patients, sometimes a survey is a really great start to get a really broad overview of what patients might want. So the patient portal, you could ask about various aspects of it. And then I would suggest running focus groups with various different types of patients, if you will, those familiar with technology, those not familiar with technology, older, younger, and get more in-depth information from those patients about what they would like out of it. And from a plain language perspective, I think when it comes to medications, again, listing them as they are, say, on a prescription or a bottle works for healthcare providers. But if there's a plain language name for the medication, such as heart medication, because most people aren't going to know the pharmaceutical or pharmacological name of what they're taking. And so I think you have to consider that a medical jargon list of medications is really not going to be useful for anybody but the health care provider. Yes, please. Go ahead.
Just thought of one more thing. So patient partners, first person and user experiences is obviously key, but from a care at home perspective, if you are able to involve the family members as well, because they'll likely be the ones teaching the person at home if they are fortunate enough to have family involved in helping with the care. So including them in the conversation would be important too.
That's a great point.
And I'm currently a distant caregiver. I am regularly assisting my elderly parents. Both of them are in their 70s. My father has myelofibrosis, so that is a bone marrow cancer, and eventually it will kill him. But in the meantime, we need to manage all his medications, his specialist appointments, his support groups. My mother has, because she's not very tech savvy, and she's the one who organizes everything. For the most part, she's the primary caregiver. She has notebook upon notebook upon notebook of all the notes she has to regularly update about his weekly blood tests and everything. It would be really, really lovely to have a plain language portal where all of that could be easily accessible and displayed in a way that wasn't just black on white, no way of customizing, and no way of properly interpreting, because that is so important, as some earlier panelists were speaking about. How you access the information is just as important as the information itself.
Thank you. And we have a question from our audience from Chris, who is one of BC Cancer's patient partners. So go ahead, Chris.
Hi, Devon. Of course, this is all about technology, and but we have the opportunity to have people who are involved. So it's kind of a reflection and a question. I've been at appointments where the technology is really exciting, maybe more exciting to the health professional than to me, and with pressure of time for appointments, you go through all the technical aspects, and they don't really have time to ask you as a patient about things you might want to bring forward. So as you are working on the different initiatives you're on, is that one of the things you're trying to encourage them to have that balance of, yeah, the technology can help, but really a lot of it's in the story and what the patient has to say.
Thank you, Chris.
Absolutely. Patient stories are integral to the whole network. And I agree with you, Chris, that there isn't necessarily that time in the daily appointments. That's why I found quite personally that support groups or groups that connect you with other patients, because we can use our combined knowledge base to help interpret some information that perhaps our general practitioner or specialist might not have the time to interpret for us or to ask us how we're doing. Because sometimes it's just nice to have someone ask, how are you doing? And you're able to honestly answer, not well.
Great, thank you. It's not so much of a question online, but more of a comment, but this person is just saying that, should we be giving a shout out to the Patient Voices Network for those who may be interested in volunteering? So yes, if you have not heard of the Patient Voices Network in BC, it is a very large group of people who have experienced healthcare, not in any specific area, but just healthcare in general, and who are volunteering their time. And you can make a request for a project, and you will get some excellent people, just like the people up here on this stage. And if it's cancer related, the BC Cancer Network of Patient and Family Partners has over 150 people volunteering their time if you need any input from them. So there's a plug for those too. Yes, please, front row here.
This discussion has brought up an issue that I've talked about among some other patient partners, but very little work seems to have been done on it, and that's medical trauma. I have one study that says that the percentage of people who fit the diagnosis for post-traumatic stress disorder 30 days after surgery, after any major surgery, is 25%, which is the same as soldiers who have been in battle. So I'm especially it sounds like you're doing some really good work in cancer treatment, hysterectomy. Do you have anything to say about medical trauma after major surgery?
I have nothing to add to that. That is not an area, but I don't know if any of our panel members might have something.
I do have a story. After I had angioplasty, and it was a situation where they were putting a new stent inside a stent that had occluded, that had clogged up. And you're awake during angioplasty, and it was very painful. And I was saying, I'm in pain here, I'm in pain here. But to their credit, the people in the room were saving my life, not worrying about whether I was in pain. And I have PTSD from when I was 8 years old, and I hadn't had a flashback in 20 years. But after that surgery, I was getting flashbacks like I hadn't, back to my original 8-year-old incident for close to a year afterwards.
I'm so sorry to hear that that is something that you are undergoing and that you've had those experiences. I agree that traumatic experiences surrounding medical procedures or even just visits where someone makes you feel like you are making it up, like you don't know your own body, like you're not the expert on your own pain level or feelings or situation, that can feel awful. And but I do know that there are some amazing practitioners out there, but it can be so hard to trust after you've had negative experiences. That's why one of the reasons it's so important when you are developing tools to consider the impacts, the potential ramifications, and to do it right the first time, because we develop relationships with our tools. And if we have a bad relationship with an app, we're unlikely to use it again. So I think it kind of builds on the idea that it's just so important to be careful and be mindful of who your audience is, who your end users are, whether they are practitioners or patients or families or just general citizens.
Yeah. They did save my life.
That's a very good point. In case anyone missed what the gentleman in front was saying, he brought up the point that there can be trauma in positive experiences too, saying that they did save his life with the surgery, but it doesn't negate the fact that it was traumatic. That's an incredible point. Thank you. Does anyone?
No, that was an excellent answer. Thank you, Jessica. No.
Bueno, yo quería agregar algo
I wanted to add something
respecto a lo que mencionaba Alfred.
related to what you mentioned.
Y sucede cuando en estos momentos, cuando tal vez hay poca oferta de doctores,
It happens now that we don't have much offers of doctors, many doctors available.
a veces en las consultas virtuales o en las presenciales,
Even in virtual appointments or person appointments,
los doctores tratan de enfocarse en un solo problema.
the doctors want to focus in a single problem.
Y a veces los pacientes tienen muchos problemas
And sometimes the patients have many problems, many issues.
y tienen síntomas que están relacionados unos con otros.
And he has symptoms, or they have symptoms that are related to each other.
Así que a veces el solo hecho de enfocarse en uno solo
So the fact to just to focus in a single symptom
genera cierto tipo de discriminación
generates some type of discrimination,
de no verlo al paciente como un ser completo o de holísticamente como un ser completo.
we feel that they are not seeing the patient as a holistic being.
Y puede suceder que esos otros malestares, otras enfermedades, otros síntomas
And it is possible that all these other symptoms, other diseases
tengan que ver con ese punto principal por el cual fue el motivo de la consulta.
are may be related to that single point that is the purpose of the appointment.
De modo que siento que hay que generar cierta sensibilidad a través de estas herramientas
So it's important to generate some sensitivity in these tools
para ver a los pacientes como un ser completo
to see the patient as a complete, as a whole being,
y podamos entender qué le está sucediendo.
and to understand what is happening to the patient.
Just to circle back to what you're saying a bit, Fred, too, about trauma. I found, I don't know if anyone is ever reluctant to include patient partners because of trauma. And speaking from my own experience, definitely not blanket statementing for everyone else, but being a patient partner did help me resolve some of my trauma because I got to be part of the solution. And now I'm an advocate for these digital tools that I've been a part of, and I'm able to help tell, spread this information to other patients and end users. So just for myself personally, if you ever are reluctant, obviously tread with care, tread with empathy, but we're ready to help and we're willing.
That's a great point. I would encourage anyone who is maybe nervous about engaging patient partners, or depending on the patient population that you are engaging, some will have more trauma than others. If you can't find support within your own organization, I know through BC Cancer, we have counselors that we can tap into, and other PHSA agencies have counselors, or at least ask how you can be supported, because there's nothing worse than going into it and having it be a horrendous experience for the patient partners. They will never volunteer again, or you will get terrible feedback, and you will never want to work with a patient partner again because you probably felt so uncomfortable and unprepared. So I encourage you to reach out to people who've engaged partners before, get their advice, be extremely prepared, and know what you're wanting the partners to do, and expect the unexpected, but be prepared for it. We have just a few minutes left. Does anyone have a final question? Okay, I'll just ask for a really maybe quick comment from each of you, really brief because we only have a few minutes. One positive experience or something that was really good about a tool that you have used recently for your care.
Sí, yo quiero aprovechar esta oportunidad
I want to take advantage of this opportunity.
porque creo que es la oportunidad ideal.
It is the ideal opportunity.
Y me recuerdo rápidamente una historia mía
And I remember my experience,
cuando yo iba al doctor con mi padre.
when I was going to the doctor with my
El
father.
doctor siempre tenía en su consultorio un cuadro
The doctor had always in his office a frame,
de esos cuadros que tienen un doctor de la época tal vez victoriana
one of those frames from the Victorian time.
atendiendo a un niño y la familia alrededor.
It was a doctor assisting a kid and the whole family around the kid.
Y una vez le pregunté a mi padre por qué el doctor no iba a la casa como en el cuadro.
And I wanted to ask I asked my father why the doctor doesn't want to go home like the doctor on the frame.
Y mi padre respondió, es que el médico vaya a la casa es un lujo.
The fact that a doctor going home, it's a luxury.
Así que al día de hoy creo que ese lujo lo tenemos gracias a la tecnología.
Right now we have that luxury because of the technology.
Así que es posible que tengamos todos un doctor en la casa.
It's possible to have a doctor at home right now
Que nos conozca a nosotros mucho más y a nuestro entorno.
that knows us better and our environment.
Thank you.
Sure. You have 30 seconds each.
Okay. So the most successful digital health tools for me
are anything that provides clear steps, like step 1, do this, step 2, do this, like just that basic really is great. And I love that. And that's always the best for me.
I like to not leave my house and put on pants.
Excellent. Thank you. That's a good way to end. Thank you so much to all of our panel members.
Take that from you. Thank you so much, Devon, and our amazing patient partners. It really is nice to have exposure to your stories. So thank you for sharing those both on the panel and in the audience. They really do make sure that us, as we move forward in this digital age and thinking about innovation, remain really patient focused, and that our digital health landscape is built on that foundation alone and not the technology itself.